So food challenge is this is the definite diagnosis, but it's not easy to do. It's not easy to always perform the food challenge, but this order is important. This is complete test, so I don't touch it. Dr. Wang already said that. And so history of IG, but I don't have much time. So first demonstration of Reagi. In the old time, IG was called Reagi. And Prausnitz and Küstner identified the serum, the presence of the Reagi or IgE in the serum in this method, Prausnitz-Küstner test. In 1966, Dr. Ishizaka identified the IgE. And in Sweden, Johansson and Wernick identified the same Ig proteins from myeloma patients. And what they did is, the great thing they did is they developed the test, RAS test. Then from this on, you can measure specific Ig levels in the serum. This is an immunocap system, and also we have several of the specific Ig assays. This is Siemens 3G Allergy. But important is how to interpret the specific Ig test. So this only indicates a sensitization to allergy. So for the diagnosis, the positive allergen specific Ig, only this one does not conclude your diagnosis. You need the careful history. So if you have the recent history of the allergen-induced symptoms plus specific Ig by skin prick test or serum specific Ig test, then you can diagnose it with the food allergy. And specific Ig can produce false positive and false negative reactions. So we cannot totally rely on these tests. And skin prick test is easy and safe procedure to diagnose of the food allergy, but this is not quantitative. But specific Ig, serum specific Ig assays can be quantitative. So this is the probability curve to predict the oral food allergy challenge. So if the Ig titers increase, probability to induce symptoms is get higher. So this type, but not black and white test. So this Ig test only tells you the probability, but the higher the titer, the more possibility that the patient has real food allergy. So, and also recently allergen component tests have been developed. So you have the possible offending food, and this food the company made a Cludes extract, and current specific Ig test detect the specific Ig to these Clude extract. But in the Clude extract, there are several components. So some of the components are not meaningful. They have no meaning. So they may be cross-reactive component does not cause symptoms, but some intrinsic components that are important to induced symptom is so this is disease-eliciting IgE, and this is non-disease-eliciting IgE. By allergen component test, you can differentiate the two types of IgE. So, and now we know many allergen components in the many food. This is plant origin allergens, but plant origin allergens, these LTPs may cause systemic reactions, and these components only cause oral allergy syndromes, because this allergen is heat labile. So if you eat and digest it, so does not cause allergic symptom. But this is LTPs heat and digestion stable. You swallow it and still the allergen still causes your symptoms. So in the apple allergy, LTP is mildly free, has a higher risk to cause systemic reaction. The reason why LTP causes systemic reaction is LTP is resistant to heat processing, digestion processing. They do not lose the allergenicity by the processing. So this component result diagnostic is very useful, and as a general concept, stable heat or digestion stable components or proteins can cause severe reactions. So this is the soybean allergen. Important allergen in this group is GLM8, 2S albumin. This is also stable. GLM2S or GLM8 is much best diagnostic ability. And so you can find the 2S albumins in the many kinds of the food or the plant allergens. The peanuts is RH2 and other allergens you can find it. And this is RH2's diagnostic ability, and very high diagnostic ability of RH2. This is 2S albumin, very stable protein. So 2S albumins may be major allergens contained in the various plant food, and maybe in the soybean allergy, RH2, or peanut allergy. So for egg allergen, so there are 5 components of egg allergen. Major allergens are GALD1 and GALD2, or mucoid and albumin. But this one is heat labile. This is heat stable. So mucoid is more important than the albumin. So if you eat raw egg, the albumin can induce your symptom, but you cook the egg very well, but mucoid still remains in the egg, then still cause the symptoms. So this is the characteristics of mucoid GALD1, and for the definitive diagnosis, you need to do oral food challenge. So if you have the apparent clear clinical history, the allergy inducing some symptom that you detect IgE by skin prick test or specific IgE assay. That's it. So you don't have to do oral food challenge. But if you eat 3 kinds of food and you got anaphylaxis, which one is the allergen? And skin prick test can identify one allergen. That's it. But sometimes you cannot. So the patient may be sensitized to all 3 allergens. So you don't know which one is the cause